She's contemplating what to do in case happiness found you. Hey, come on, babe, follow me. I'm the pipeline. Follow me. I'm the pipeline. And I'll show you where it's
Welcome to the Meat and Potatoes podcast. Today I'm joined with Stephen Fabiano, who is the founder of FIA Care. How are you?
Well, how are you doing?
I'm good, thank you. And I like your flowing locks. Your
Thanks.
hair is really nice.
Yeah, Scott Paul asked me if he could have them.
Oh, he said no.
I said no.
Okay, smart. It takes a while to grow that good of hair, right?
Less time if you eat a lot of chicken.
Okay. All right. So you were on about a year ago.
That's right.
And a lot's changed in a year.
Yeah.
But for those listening for the first time, what is FIA Care?
We do primary care and mental health delivered to the home or virtually. We do it for incredibly low prices. You can either buy subscriptions or you can join for free and pay really low rates.
And so the current version of what people might do is call the doctor,
Yeah.
maybe get an appointment this century,
Yeah.
and then drive there and see the doctor, whether it's for something that's wrong or just a checkup.
Right.
But with your options and the tools that you built, how is that different?
With our options, you can access care directly through our app. So you just instant message the provider and then say, hey, can we, I've got this pain, or my knee looks like a cauliflower, or some sort of something. And then they'll set up a video call right there. They'll set up a home visit with you, and they'll come out and check you out and get you on your way. So the one thing you forgot in that example is that you're gonna have to take off work.
Oh, yeah.
Or pick your kid up from school.
Yeah.
As well.
And then fill out paperwork and then get
Yeah.
a bill or something.
Right. No, our pricing's super transparent. I mean, you just get billed right through the app, or if you buy a membership, then it's all inclusive,
Okay.
like a Mexican resort.
Love it. All right. So this kind of was the way it used to be back a long time ago. The doctor might come to you
Yeah.
with his little satchel.
Yeah.
Rich people, this is what they've always had, right? Like doctor can come to you and all that. So now it's accessible to a lot more people, and
Yeah.
a lot more convenient.
Yeah.
So obviously, if you've got a compound fracture, this isn't the right tool. But sniffles, sneezes, general health questions and concerns, you'll get on the phone or text
Yeah.
to start out with a nurse practitioner, or an actual MD, right?
Yeah.
And then the video call, they'll be able to discern, like, let's figure this out, or that, yeah, you should maybe go to the emergency room.
Yeah. I
And
mean,
everything in between.
you would be amazed at how much you can get through a video call. I mean, I've been amazed. We've diagnosed like skin conditions over video calls, sent the prescription over, got people sorted. I mean, it's pretty wild. The patient stories where they're sitting there languishing over whether they're going to go to the doctor over this rash that started as something this big and is spread across their leg, and it can get solved in a matter of minutes.
Yeah, that's great. Because, like, these medical folks went to school for a long time, and they do this day in and day out. And it's kind of a disservice to them to think that you need to show up in the office and have a really thorough exam, because they can probably figure most things out, to your point,
Yeah.
through verbal and video.
Yeah. And the nice thing for the providers is that they're not sitting there filling out extensive documentation for claim submission to the insurers, because we're totally cash pay right now.
Yeah.
The providers love it, because you wouldn't believe how much time they spend just in pure administration.
Yeah, which they hate,
Yes.
and you can't read what they write anyways.
Right.
Right. Well, love the idea. And so what are some of the things that the platform tool won't do?
It won't cure cancer. And I say that somewhat in jest and somewhat in reality. You do get people looking for oncological care, and we can we can help get you to there, but we're really that that first medical home for someone to sit, and that whether you're in Layton or you're in Santaquin, you can have the same provider wherever you go, which is not currently the case. So we right now we're not doing treatment of fractures or anything like that, but virtually everything that you would go to your primary care provider for, your primary care doc or nurse practitioner or physician's assistant, that's what we're treating. So
blood draws.
Yep, we do blood draws. We've done blood draws in the parking lot of Caputo's.
Okay.
For patients that was where it was most convenient for them.
Yeah, interesting. And so, area of coverage, you mentioned Santaquin and Layton. Is that kind of the geographical region?
Yeah, it's like Utah, Weber, Salt Lake, Tooele, and we don't have any patients in Park City, though. I think we could make that trek out there, but we've expanded to Arizona as well, and are kind of branching out in more geographies pretty quickly.
Very cool. So how often do the physicians go to the people's home versus they resolve it video?
I'd say probably 16, like 12 to 16% of the time they're going to want to do a home visit, and that's excluding the times where it's just, hey, they have a physical. You got to do a physical in person. Yeah. That's why they call it a physical instead of a virtual.
Yeah, makes sense. So this is solving a pain point that I think the majority of folks have.
Yeah.
Especially for moms with a bunch of kids, folks with careers. One, the time saving,
mm-hmm.
and probably almost all the time more affordable, right?
Yep.
And the doctors save a bunch of time on not doing admin costs. So what in your previous career enabled you to come up with this idea and build out these products and do the biz dev and do everything that a startup CEO does?
I was working in Medicare and Medicaid for Optum, which is part of United Health Group, which is the biggest entity in healthcare ever. And when I looked at the patient data over time, you saw that really since 2010, primary care utilization started going down, and acute event costs started rising. So you can kind of intuit that story. I go to the doctor less. I'm postponing the treatment of things until they get really bad. Simultaneously, you see a rise in the annual premium for a family from about $10,000 for a high deductible health plan in 2010 to now it's like $21,000, $22,000 a year for that high deductible health plan premium. And so, but along with that, your out-of-pocket maximum is way higher, your deductible is way higher. And so a lot of patients and companies are sitting there being like, and we're forking out a ton of money for these health plans. Nobody sees the doctor because they still have to pay out of pocket until they hit $7,000 of spend, or something. And so that seemed to me to be an opportunity to take on that front end risk of healthcare, which is all of your primary care, preventive care kind of stuff, and offer that directly to patients outside of the costly, health insurance administration type stuff. And so that was the hypothesis. And then the past year has been proving that in practice.
Yeah. So the past year, there's obviously, as a healthcare company and CEO, there's been a lot that's happened. How's that impacted you and your company?
Well, we went from a dental business to a primary care business. We were doing on-site dental with companies, and then COVID shut down. I say COVID. The policies from COVID shut down the company offices. So we had to pivot towards something else. But on the positive side, now you have this huge demand. They want their tacos delivered to their home, and then if you say that you can get your doctor delivered to your home, then it's just one more thing not to get off the couch for.
Yeah. Absolutely. So, with all the things that were changing last year, you guys were in panic mode or like in a confident mode that you've got the product, you've got the infrastructure, and you can pivot. Which one was it?
I'd say it was the latter. I've played a lot of video games as a youngster, so I don't get rattled. That's, but I also have an insane addiction. No, I'm just kidding.
So, as the CEO, how do you kind of divide your time between biz dev, product development, raising funds? What are you good at? What do you wish you didn't have to do? And how are you building your team in conjunction with those traits?
I probably spend most of my time on biz dev and product ideation. It's been a very big eye-opening experience for me, because I thought of myself as a generalist, but what I've realized is that, and thank goodness that we've built out a team to address these deficiencies. But I am very good at finding out finding the right product, fitting it to customers, getting those customers, getting the revenue where it needs to be. But as far as day-to-day operations, I rely heavily on the team to deliver those pieces, because for better or worse, I'm afflicted with the shiny penny syndrome, where I see something interesting and I say, ooh, we could do, I don't know, at home, Eastern homeopathic massage as a service. We should explore that. And everyone else says, you know what, let's just deliver on the core stuff right now, and then we can get to those things. And so it's been, I know where I'm good and I know where I suck.
Yeah, shiny penny. That's a good one. All right, so you mentioned expansion in Arizona. How does that work, right? Is that they're just the state closest to us to the south? And what are the first initial reach outs to, because you've got to have the providers, right? Give us a really quick version of how you get new market share.
So we'll do initial recruiting in an area to build up a provider pipeline, and then we'll start reaching out both in individual associations or employers to build that threshold of employees to open up service. I mean, the last thing you want to do is hire everyone and then have 5 patients
Right.
In the area just get killed. So we make sure that we have the patients before we pull the trigger on bringing on all of the providers.
Yeah, very cool. All right, so business model a little bit. I was looking at the website really quick before we jumped in here. There was a $0 sign.
Yeah.
And then there's a box next to it with a different dollar sign. But talk about the business model. How do you guys develop that? How do you tweak it?
Yeah.
And what's worked and what hasn't?
Well, we have 2 things that we sell directly to individuals, which is that family plan, which is $150 a month, and you get unlimited house calls, video calls, labs, sending your prescriptions to whatever pharmacy, and then we have the $0 plan, which is you get unlimited access to the instant messaging through the app, and then really cheap prices on individual services like the video calls or the prescription renewals or the house call or the labs or something like that. So like labs, typically, if you go to the lab and get all your primary care labs done, you're looking at like $350 to $500, and we charge you $50 for that. So it's a heck of a lot cheaper. And to your second question, what has worked, what has not worked? For employers, it really works. The memberships, like the subscription style stuff.
Yeah.
But for individuals, we found empirically that it just doesn't hold water. I mean, like, and as soon as not just me, as soon as we put ourselves in the patient's shoes, we said, am I willing to spend that much money a month on something that I might need? I mean, insurance, people do that. I mean, some of it's required by law, like auto insurance. Yeah. But like I think people are really sick of paying for things that they might need.
Right.
And so we decided to come up with something where they could pay pay only what they need when they need something. And so we thought about, well, should we charge for the instant messaging? I was like, I don't think so. I think it's so different having constant access to your PCP. I mean, if you try and get your doctor's cell phone number, they will
Right.
block and tackle you for until the day is done.
Yeah.
And so it's a big shift. And so we wanted to lower that threshold because obviously we want to make money, but our mission is to lower the cost of care because, in my opinion, there's a whole ton of rent seeking in the industry, and patients are none the wiser because, like an auto mechanic, you take your car in and you're like, "What's wrong?" They say, "Well, these 45 things,"
Yeah.
and you don't know anything about. I mean, you may personally, but the general person doesn't know anything about cars. And patients are the exact same thing. They don't know anything about the industry. They don't know anything about medicine. So they're completely at the mercy of whomever they go to.
Yeah, and you guys simplify that quite well.
Yeah.
And so, like enterprises, right? Startups, enterprises, big companies, they'll still offer insurance and all of that, of course. But the premise is that they throw this into the benefits and perks as well. It'll ultimately save the company money.
Yeah, if you're a self-funded plan, which means you have you're ultimately covering the cost of all your employees, we save between 12 and 20% on the total healthcare spend. Honestly, just through mostly through ER visit avoidance and prescription savings. But we're signing up a bunch of startups right now because we're getting them on our free plan and saying give your employees something because we know your budgets are tight and you want to raise capital soon, but you're also trying to retain people. So it's this, how do you balance those things?
Yeah, it's a pretty good tool for a startup. Benefits and the kind of back office stuff oftentimes gets avoided, and you guys kind of take care of that.
Yeah, they either pay nothing or pay a low fee for all the employees, and we do all the dirty work.
Yeah. As far as data and metrics and stuff,
Yeah.
you guys have a decent amount of runway that you've gone through now, and how do you guys use that to help develop new products or ideas and pricing?
Well, I'll give you an example. We didn't know when we started the choice plan, which is that $0 plan. We didn't know exactly what was going to take off. We figured it would be a good offering, but what we started seeing in the patient data was that the biggest usage started coming from people looking for prescription renewals because they could get a prescription renewal for $25, and rather than waiting 6 weeks for an appointment and paying a couple $100 for the prescription renewal, they could call in for $25 and get that prescription renewal instantaneously. And so with that, we've started going heavier in promoting that product. I mean, to me, it wasn't even a product. It was just an offering. It was just a feature of the offering, and now it's a pretty effective promotional tool. And then we find in the patient notes people are asking for this treatment or that treatment, and then that's where we go back. It's okay, we need to hire this type of provider, that type of provider, and deliver that.
Cool. So it's fairly actionable.
Very actionable, yeah.
Awesome. And you mentioned fundraising as it pertains to other startups. You guys are still a startup and have to worry about those types of things as well. What are your plans with that?
Well, we've been bootstrapped up to this point. I've been talking to a few VCs that are interested in us. One guy, I don't know if do you know Landon Ainge?
Mm-hmm. He's awesome.
Yeah, he's a super cool guy. I think he's 17.
He looks it.
He looks it. No, he's a super smart guy. Very, very cool. So we've started exploring some solution with him. And if you saw us at Start Madness,
Yeah.
I'm no PowerPoint deck maven. There are PowerPoint deck mavens. That was Landon's first comment. He's like, we're going to need to change everything because this is garbage.
Yeah. Value of pitching at pitch competitions, though. Have you guys done that several times or just this once at Start Madness?
I think this is just this was the first one.
And what was that like for you? Because you kind of got to get your house in order, right?
Yeah.
Is there value in it, or
Tremendously. I mean, we got ton of business coming out of it, and I've been working out of my basement for going on 8 years, and so you just start to disconnect from reality and disconnect from other people, and so that was like this a terrific baptism of awkwardness back into the social
yeah,
the social sphere of Utah.
exactly? Yeah, I think win, lose, or draw. There's a ton of value in putting yourself out there. You never know what'll happen. You could win it, or you could get a new client. You could get a new friend, and either way, you're having a little bit of fun
Oh yeah,
broadcasting what you're doing.
yeah.
Very cool. All right, so in addition to fundraising and all the other stuff you have to worry about as CEO, what are your goals and hopes for the next 12 months for FIA?
We're expanding into a couple other lines of business. We've been growing not just around the employer market, but we've been growing in the Medicaid eligible market, and so we have some big contracts that we're working on to take on some of that population here in Utah. We've got some stuff outside of the country going on that should be fairly sizable, and we've also started working with another firm in Arizona to plug in our offering directly within the employer health plans. I mean, there are some super smart people out there that can configure products way better for employers.
Yeah.
We've been selling to employers, but it's this, it's like selling just ink cartridges for printers. Like, that's great, but we really want the whole printer plus the ink cartridge in some cases, especially for the large employers. And so that's been very, very big.
Cool. And then if folks are interested in what you've got and might want to learn more or be a customer, how do they get a hold of you or your team?
They can send an owl to Privet Drive, and no.
What if they're out of owls?
They're out of owls. If they have any owls, I'll be surprised. They can visit our website, fia.care. It's FIA.care, and all of our contact information is on there.
Very cool. Well, thank you so much for joining us today, Stephen. It's been fun. There hasn't been a lot of repeat guests on Meat and Potatoes, but with a healthcare scaling company, I was glad that we were able to get you back on and hear about your updates. So we'll do that again soon.
Thank you so much, sir.
Thank you.